My name is Juliana Regis da Costa e Oliveira, and my student number is 881064149. And today I will record my assessment for unit 411 and 412, section plan 3, and the topic is reporting to an incident. This assessment is with 4 learners and 1 trainer.
Okay, guys, welcome back, everyone, to section 3, my pen. So before we begin, I would like to acknowledge the traditional custodians of the land on which we meet today and pay my respects to their elders, past and present. So, guys, today's section is about responding to an incident, okay? So, but first, let's link back to the session 2. So we talked about safe work practices, like workstation setup and a discussion about the workstation checklist, assessment checklist. So let's do a quick recap. Let's go here so you can see. So after our last session, we are able to access the workstation, make some ergonomic adjustments, and apply the safe working habits. So guys, I want to know what is one change you made to your workstation after the last section? Let's start with you, Luis.
Yeah, I had a meeting with my manager,
Okay.
and I requested a new chair
Okay.
because my chair was pretty old. And after 2 meetings, they bought one new chair,
It's good.
and yeah, much more
What did
comfortable.
What did you choose? Tell me.
Why?
No, what? What was the type of the chair?
Office chair with
Yeah.
multiple adjustments.
Nice.
And yeah, for my back and good for my neck as well, and I can change the height pretty good.
Okay, good. And you, Patrick?
I adjust my monitors and the space between the monitor and keyboard to place my documents.
You shared this last section. Good on you.
Thank you.
And you, Helpson?
Yeah,
Tell
I have
me.
also escalated to my manager. We did have our WHS officer coming to do an inspection and an assessment.
Mm-hmm.
So we're just now waiting for them to bring back the report with the recommendations. But they already expect that we're gonna have to replace my desk.
It's your desk. You'll be
Yeah.
good. And the cable that you
Oh,
told me.
that's been fixed. So yes,
Ah.
but yeah, the IT staff has already connected to a longer cable, so it's closer to my workstation.
It's good. Okay, Mel. And you? What the modifications that you have done in your workstation? The mouse. So now you can place better your arm and then be much more comfortable with your back and then do everything you need to do with the mouse. Good on you, guys. So it's very nice to hear this. So now let's move on to today's topic. So responding to a workplace incident. So think for a moment. Have you ever seen or been involved in a workplace incident? So share your experience, guys, with me. Louis?
I had one incident to report.
Yes.
Once I saw one nurse falling. The floor was wet, and she fell off.
Oh,
Yeah, then she had like an ankle fracture.
oh,
Yeah.
okay. Thank you for sharing. And you, Patrick?
I have an incident myself.
Oh,
Fell off the roof.
oh my
Fell off the roof.
I
gosh.
broke my wrist. Yeah,
Really?
I haven't set up my anchor points properly.
Oh.
Wow. Are you okay? So it was
Yeah.
a long time ago?
It was a
Okay.
long time ago.
Oh.
But I lost movement, so
Oh, yes, so we can see. Okay, so
Did you-
then you can, after you're gonna share more this experience, okay? But don't worry.
Yeah, I want to know in details.
Yes. And you help some, let me know.
Well, I have reported and as well analyzed some incidents because I work in a hospital as a nurse, and we are exposed to a lot of risks. So we have had situations, especially with sharp injury. That's one of our main risks we have as nurses, because we do manipulate a lot of sharp instruments and during the work. So I have seen a few, and I had to support the staff to go through the process of not only reporting the incident, but also all the care necessary after the incident. But sometimes I'm also asked to be part of a committee that analyzes the incidents. So we may get the report, and then we need to go back on documentation, on patient's history, and check what has prompted or what has caused the incident, and suggest what improvements we can put in place.
Oh, it's good.
Yeah, but the main incidents we have are mostly related to the patient, especially falls. These are the main ones. For the nursing team, it's either related to infection or sharp injuries. These are the big ones.
It's good to know this. Yeah. And you, Mel, could you share? No? You haven't seen anyone? It's okay. So it's good. So we're gonna discuss this today, and then we're gonna have more experience, and then maybe be able to report if you see something. Okay? Thank you, guys. So, so these are great examples. So when you show how common workplace incidents can be. So today we will learn how to respond properly to keep ourselves and others safe. So this here, if you have a look in the PowerPoints, so the goals that you're gonna have for today. So the first one is understand the importance of responding quickly to the incidents in the workplace, and why you need to the actions matter. Learn the correct procedures for responding to an incident and include the emergency situations. Identify work health safety requirements for reporting incidents and the necessary steps to take after the event occurs. And practice the skills required in a practical scenario-based activity and notify the right people. Okay, guys? So by the end of this section, you should be able to be confident in your ability to handle incidents in the workplace, ensuring your safety and in the safety of the others. So to start again, so I will ask another question. So has anyone ever responded to a workplace incident, and what happened? So if someone want to share your experience, have you respond?
But if I see an incident
And then, if you
Wrote
respond,
like
yes, if you be like included to respond, to report the incident.
when the nurse
Because-
fell,
yeah.
I was the first one that attended her.
Okay.
Then
And what did you do to report, this?
Oh, okay.
this
You mean
incident?
like written report?
Yes, this.
I escalate to my manager.
Okay.
And then I completed. I filled the forms,
Okay.
the report incident forms. I included details and everything that we saw, and I gave to the manager, to
Okay.
my supervisor.
Okay. Did you help the lady?
Yes,
Fell?
yeah, definitely. But guarantee she was safe, and we put like signs. The floor was wet. Then we called the Met call to help her, and the doctor came. The other nurse came, and she was seen in emergency department, and they identified X-rays and everything were done, and they identified this. She had only a ankle fracture.
Okay,
Yeah.
so it's good that you have experienced this before. And you, Patrick? So, tell me more about your experience, actually. Did you have some help for us?
I have
Triple
to
O.
help myself.
Did you call Triple O?
Yeah, I called Triple O. Yeah, the ambulance came, took me to the hospital.
someone report or?
No, I
you just-
report myself.
Yeah, so you
I
did
advise the
everything.
company that I had an incident.
Okay.
They send me a document. I have to,
Fill all the
fill
form.
up all the forms with photos and details. Photo of my letters, photo of my boots and
Everything.
everything.
Oh.
I have to report everything. All
Okay.
my
Did you have a good help for your company? Yeah.
It was a good help.
It's good. And you have some, so yes, I think you had a lot of
Yeah,
experience with
but-
this. So
but-
share only.
But very recently,
Uh-huh.
a few days ago, we had a nursing student doing day placement at the hospital, and she had a needle stick injury after administering medication to a patient. And so part of the staff on the floor at that stage was not 100% sure of the process to follow. So they asked for my requests, so for my support. So firstly we ensured that that the student had followed all the process that we recommend when we have a sharps injury. So that includes washing the injury whenever possible. If it's bleeding, we allow blood to flow out.
Did you squeeze?
That can
the-
reduce.
the
No, we
thing?
should not squeeze. It's
Doesn't
not
mean-
recommended to squeeze,
just
but if
leave.
blood is flowing, we need to leave
Just
it
leave.
flow. That reduces the chance of infection getting into the wound.
Okay.
Wash with water and soap. Obviously, after being cleaned, apply any compression or occlusive dressing. And then immediately, what we do at the hospital, we send the staff to be assessed by at a specific pathway for sharps injury via the emergency department. So they go via the emergency department, and they are assessed by a doctor, and the doctor will assess the likelihood of having or how risky that exposure would be, and based on that we decide. So sometimes we decide what the staff needs to take. Most of the times, if the patient agrees, we will collect blood samples from the patient and from the staff to assess the serology for blood-borne diseases, and the staff may be recommended to do post-exposure prophylaxis. So they will be prescribed specific medications to try to reduce the risk of blood-borne virus transmission, especially HIV and hepatitis.
And who's the one need to report this incident?
So we need to report immediately for the line manager. In that case, is the manager of the department,
Okay.
the nurse manager of the department where the incident happened. Because it involves sharps injury, our infection control team needs to be reported as well. So once you go through emergency with the staff, the pathway already starts.
Okay.
So there's an automatic notification system that
okay.
goes for this. It's a specific pathway for
Okay.
sharp injuries for staff or for incidents involving staff. But yes, the line manager needs to be notified, which is the first manager in the department. The infection control team is notified as well, because they will then follow up with the blood tests and what happens with the post-exposure prophylaxis and the employee. And because it involved a student, we also report to the uni, because the students not our staff. We have an agreement of collaboration with the university to provide them the workplace practice that they need, but then the union coordinator needs to be notified as well.
Oh, interesting.
But if her blood test came back negative and the patient agrees and is negative as well, does she need to start?
The prophylaxis.
Yeah, or just watch and wait the window.
There are other criteria to be assessed, but if both of them are negative, and we can have negative for HIV, for example, and the level of the injury is considered. So in this case, for example, it was a subcutaneous injection, and there was a very small needle
Not too
used for
much
subcutaneous
blood.
injection. So
Yeah.
the likelihood of transmission of infection in that case is very low.
Low.
So when we consider that the likelihood of the injury plus both tests negative, it's likely that she would not need she would not need. But let's say it was an intravenous device with visible blood present, and that would be
Like
maybe
that.
recommended.
Okay.
That's the
Okay.
assessment that the doctor in emergency needs to make and
Okay.
decide.
It's very for
Yeah,
us.
thank you. Thank you
Depends
for
on
the
the
information. It's nice, yeah.
Yeah.
And you, Mel, could you share something with us? No, you never experienced anything. Okay. Okay, guys, so let's move on, okay? Okay, guys, let's start by understanding why responding quick and correctly to the incident is important. Not only does it help the injured person, but also ensures that workplace policies and legal requirements are met. So as you can see here in the PowerPoint, guys, is the step-by-step you need to follow when you have the incident, when you need to report the incident, okay? So the first thing you need to access the situation. So look around and check if it's safe to help the people or the person. Then seek for help. So call to your supervisor or the first aid officer or the emergency services, okay? And then provide the basic assistance. So if safe to do so, give basic first aid, okay? Only if it's safe. And then you need to follow the forms, so you need to do all the documents, okay, to inform what's happened in the scenario. So as you can see here, we have the steps. So make sure it's only main 4 steps you need to follow. Very quick. Access the situation, seek the help, provide basic assistance, and document the incident. Okay. So now that we have gone over the process, I will move on to the practical part. I'm going to show you guys the CPR video, and then you're gonna try to practice this. Okay.
A quick guide to CPR. Check for danger. Check for a response from the person. Are you okay? Squeeze their shoulders and hands. No response. Send for help. Airway. Check it is clear. If you need to, clear the airway with your fingers. Check if the person is breathing. Look, listen, and feel. Not breathing normally? Start CPR. Hand on the lower part of the sternum, other hand on top. Lock the fingers. Lean over the chest with your arms straight. You want to push down hard enough to depress the chest by about 4 to 5 centimetres, or about 1/3. Move into position for 2 breaths. Pinch the nose, cover the mouth with yours, and breathe. Keep repeating 30 compressions and 2 breaths until medical assistance arrives. For young children, use the same position for your hands as before. Depending on the age of the child, you will want to push with less force. You'll still want to achieve a compression of 1/3 of the chest depth. For an infant under 12 months old, simply use 2 fingers to push on the chest. No head tilt is required. The size of the breath is less than for adults, but enough to make the chest rise slightly. Often a puff of the cheeks is enough. Compress the chest 30 times, then 2 breaths. When the defibrillator arrives, turn it on and follow the instructions. That's danger, response, send for help, airway, breathing, CPR, and defibrillation. For more information, including on training courses, visit royallifesaving.com.au.
Okay, guys, let's start with our practical part, CPR. So I don't have now a big doll, but you're gonna perform in this little TED, okay? Could you help some to do the practical part?
Sure.
Let's do the CPR here. So let's simulate, like here it's the floor, okay? And then I need to start the CPR. So what's the step you need to do to perform the CPR safely?
Do you want to go straight to compressions or do
No, the step by step. So you need to check the
Check for
danger,
danger first.
everything,
okay.
okay? So the step you have been shown in the video.
Okay. So yes, I initially would check for any danger in the surrounding the patient, if there is any danger for myself or for any other people around. If there is no danger, we check for responsiveness.
Response. Yeah.
And we can touch the person and shout and ask their name and apply a pain stimulus. If there is no response, send for help.
Yeah.
So
Can
if,
go.
depending on the context, depending on the context, could yell to other people or call 000
yeah,
if you
000
are
if you're
external. Check for airway patency. In this case, if it's a baby like this, we would like to maintain a neutral position
Yeah.
and of the head and open the airway. Observe for any foreign body or obstruction, if anything is present. If we're in a clinical environment, we may use suction or other instruments, but if not, we can position them on recovery position and
Yes.
allow it
to
to
roll the whole body
the whole
to
body.
one side. Yes.
If the airway is patent, we check for breathing. We can look, listen, and feel for
Yes,
airway
perfect.
coming through the upper airway. Also observing the raise and fall of the chest for 10 seconds. If there is no breathing, then we start CPR.
And how you need to perform the CPR? Tell me.
For we're gonna use for a small baby, we're gonna use we can use the middle of the chest
Yeah.
or also the lower part of the sternum, but the middle of the chest is appropriate as well.
Yeah.
We may use, depending on the size, we may use 2 fingers to provide the compressions.
How
The-
many compressions?
We are gonna provide compressions if not providing respiratory support, we're gonna give 100 to 120 compressions per minute.
And for a general people like adults?
The same for adult, 100
Okay.
to 120. The only difference, we're going to try to compress about a third to the depth of the chest and maintaining 100 to 120 compressions. Sorry?
That's a lot of compression.
Yeah, it
Yes,
is.
it's approximately 2 compressions per second.
Yes.
So, if the baby is too small, we can use your non-dominant hand to maintain the head in a neutral position while providing compressions in the middle of the chest.
So this is the reason it's good to have another colleague to help you in this case because you're gonna be tired. Yeah. So everyone now it's common. So this the reason you need to ask for help. So
Every
then,
2 minutes, huh?
and then another one another one now it's in the same place as you. So ask for help and then you can.
If you are trained or anyone is available to provide rescue respirations,
And then you can do it.
we can do that, and then we would do a rate of 30 compressions to 2 breaths.
Yes, perfect. This I wanted to know. Thank you so
No
much. You can
worries.
sit down. Yes, guys. So as you could see, so it is a good to perform, but you need to perform the CPR. Okay. So now, guys, let's see. Let's go through a different scenarios. Let's go some discussion for common workplace scenarios that we can have in our daily work, and then how we need to do when we need to report an incident. Okay guys, let's work in a pair. So you can work in a pair, and you too, guys. So you can still have 4 different scenarios. So I will read it for you guys, and then let me know if you have any questions. Okay. So the first one is a split and fall accident near to the reception area. So how you need to report this. The second scenario is a colleague choking while eating lunch. The third one, a spill of hazard chemicals in a storage room. And the last one is an office fire alarm going off unexpectedly. Okay? So discuss in pairs and then give me the answers. Okay? Okay. Hello. So you can discuss with Patrick.
The 4 ones or 2
That's
only?
The two final, yeah.
Okay, spill of hazardous
And then you can-
chemicals in the storage room. And
We can
an
check
office
for
fire
danger
alarm
first.
going off. I think you're gonna have like a chemical
could
substance.
be
You have to.
yeah, just possibly, but they could have
wash
had.
with
We could have danger involved. Maybe.
water,
But yes,
current
check
water.
for danger, make sure it's safe.
and have to try to find the signs
Then
of
obviously
the chemicals.
Yeah,
Probably we
identify
have
some first, identify the chemical.
identifies that probably we have in the workplace
Then they
the
need-
chemicals that they have and what to do, like
Yes.
fresh or current
Listed
water
before, what are the
for
steps? So
20
first
minutes
provide
or
assess
10
for
minutes,
danger, make sure it's safe,
and
then
then,
you provide first aid.
probably call
And
triple
then-
zero or central emergency.
Yeah, I
something
think
like
to assess.
Patrick,
assess
if
the
you need, you
situation.
can use the audio, okay?
Yeah, go ahead.
So-
And assess the
that. And the
situation,
fire
then
alarm
So this is
going
nice.
off,
Run.
run, yeah,
Yeah.
yeah. I'm expecting
And we may need
to have,
because
like,
depending
some
on the cause of this,
training
maybe there is
before,
still the reason.
or,
is
I mean,
still there,
in
for example,
advance,
could be
in this situation.
signs and isolate
if
the
the
area.
fire alarm goes off, you have to
What
follow
about
the training that probably we
Choking.
already
Mm.
have done. And
Yeah, in
No.
theory there's no
Probably
hazard, but yeah,
procedures
make
for it.
procedure,
sure.
yeah, not to use like
But the
lifts,
person itself
goes
could be a
to
hazard
evacuation.
because they are
yeah,
too
to
agitated.
like stair,
so you
use
need to be
stairs
careful
instead
how
of
to approach
lift,
them.
close the
Um,
fire doors,
If you can,
and
you can perform the, if you
uh,
can, if
try
you're
to
trained, you can perform the
mm,
Heimlich maneuver.
leave. We
try
should
to
have to
remove
leave
the
the
foreign
place
body.
without grab or thinking
Call
about
for help.
our
And
belongings
After the person is safe,
and
then we report.
yeah, I think it's something like that. Do you have something to add? No, good.
Okay, guys, are you ready, guys?
Yeah.
Yeah? Okay.
Yeah,
let's-
yeah.
Okay, so, okay. Do you want to start? So let's go the first two. So the split and fall accident near the reception area. So don't forget the steps that
Yeah,
have,
you mentioned
okay?
before. So the first
Yeah.
thing is we would assess for danger, make
Mhm.
sure that there's no other risks for us or for the person. If we can mitigate and eliminate the danger or the risks, we would.
okay.
Then we would assess the person, providing first aid and call for help or other support that the person may need. And once the person has been appropriately helped, then we would report the
Okay.
incident. Following that, if there is still a situation that could pose risk to others, we may need to isolate the area, put signs, and
To make
sure.
the others
Yeah, to
safe.
make others safe after the
Yeah,
incident.
yeah.
Yeah.
Okay. And the other one, the colleague talking while eating lunch. What do you think, Mel? But if you need extra support, it's fine. Help can help you, okay?
Yeah, we did have a conversation. Basically the same thing, right? So assess for danger first, and then we also discussed here that in this situation doesn't seem to have any clear danger for you, but the person itself may be agitated, and that could pose a danger
Yeah.
for you. So make sure that you can safely approach the person. If you are trained to provide first aid, if you can provide the Heimlich maneuver if you know how to perform that. There's some strategies. You can do that standing up or could go lying on the floor. If the foreign body can be removed, the person should then call for extra help. The person may require further support after that, going to a hospital, to
Yeah.
an emergency, and definitely
Then
report.
report. Okay. Thank you, guys. And you guys. So let's start with spill of hazard chemicals in a storage room. So how we need to report this.
Report or give assistance?
So how we need to report to this incident. So yeah. So did you remember the steps you need to follow when you need to report this?
Yeah, we start with if we see someone that was like was injured with a chemical, that's the thing.
Yeah.
Yeah. First of all, make sure there is no danger.
Yeah.
If it's like a can or a container, it's not like more liquid, chemical liquid that can burn other people, if it's the case, or if it's a tap, or if it's a big container, it's different. And then I hope we know the products that we have, and
And file documentation.
I'm
for
yeah exactly.
healthy products.
I'm assuming we have the name and what to do. Maybe wash with
What
water
you need to
for
respond.
10
How you need
minutes,
to
how to
respond.
respond. And obviously, after, make sure everything is safe and the place is safe. We should call O. The employee needs to go to emergency and have to do a written report,
Yeah.
escalate the situation.
Well done. And the final one, what are you gonna do for the fire alarm?
Run.
But first of all, I think you need to find out why the alarm going off.
Yeah.
And especially
And then
if there is a
report
real
this.
danger, and then
Yeah.
find documentation about the evacuation.
Yeah, I hope we probably had some training before in what to do in this situation, how to respond, and basic things like don't use lifts, go and use stairs, close the fire doors, just leave the place without thinking about our belongings and stuff like that. And if it is a real fire, if it is not, it's just a training or was an accident, probably the alarm will be turned off quickly.
Yeah, or repair something. So yeah, it's not working properly. Okay,
Okay,
thank
yeah.
you.
No worries.
Thank for your answer, guys. And now I can see that you can follow now the steps to report the incident that you see or you be involved in one. Okay, so let's finish our class now. Okay, guys, well done, everyone. So it's a fantastic job. So we have done all the things, and now I know that you're gonna be very safe if something's happened in our workspace. Okay, so Helpson, do you feel comfortable explaining the incident response steps?
Yeah, I think
Yeah?
so too. Do you want me to
Yes,
Say?
yeah,
Oh.
yeah. What
check
do you-
if there's no risk to danger
Okay.
for you first, provide first response or first aid to the person, and once that person is safe, report the incident.
Thank you. Well done. And you, Patrick, how did you feel using the audio
I gave
for the
much more
activities?
support than the previous session. Yeah.
Yes, it's
Yes,
good.
thank
Was
you.
nice. It's good. Luis, did you feel using the visual guide that I use here in the point for the practical activity? Did
Yeah.
it help you?
Yeah, it does help a lot.
Yeah.
Yeah, I'm a visual guy, so I need this kind of support.
Okay. And you, Mel, how did you feel with extra support from me and for sure for Helpson?
Good.
Good. Did you feel be okay to finish all the class, all the activities? Yes? Okay. Okay, guys. So thanks so much for your participation. So this is our last section from now. After 3 sections that we have been talking about their work health safely. And now I see you another time. Okay? Thank you so
Okay.
much and bye.
Okay, see you next time.
Okay, guys.
Thanks,
bye.
teacher. Thanks, guys.